So this week I am Amber and I'm Madison and I'm Michelle and I'm Caitlin Martin. So this week is a fun week. Welcome to summertime. So Amber's not here. She's having a glorious time, I hope, in Scotland. So can everyone see the PowerPoint that just made? Okay. Now you can't see it, the right thing. Okay, now do you see the right one? Like the correct view? Yeah, okay. Well, welcome everyone for coming to the May lab meeting. It feels like summer outside and schedules are starting to be like summertime, so that's fun. So we'll start with some updates and then we have a presentation by Ira to follow. So CPDD is coming up next month, and everyone that submitted something got accepted, so it's really exciting. So we have a lot of posters, and then the project that I'm working on got accepted as an oral presentation, and then the abstract that Madison did with me and Dr. Moeller also got accepted for oral presentation. So the Ivy Lab will be all around New Orleans for CPDD coming up, so that'll be exciting. And then also we found out just recently that the Castle project, the initial paper, also got published. This is like years in the making, so it's really exciting. The team that's been working on this project has been working on it. There's two students, for example, that have been working on it since they started medical school and they're about to go off the internship. So it's about 4 years. So we're excited that that just got published. And it's in an open access journal, so everyone can access it without a subscription. And then we also just found out just today that Michelle's manuscript also got accepted, but is not yet published. So we'll put that out at the next lab meeting, but that one just came through today, Michelle's manuscript. And then these are three more in addition to Michelle's that just got accepted today. Michelle's was something from the SORT study, a secondary analysis. And then Madison has her paper that hopefully will get accepted after this next round of review. It was pretty hefty, but she did get that in before she went out maternity leave. And then we have a couple others that have been lingering around. You're going to hear more about social media later on and with Ira presenting today. So just to remind everyone about everything that we have going on. And then just to go into updates about each of our studies. So I kind of dropped the ball already. So Madison had her baby this past Sunday on Mother's Day. So baby Evelyn. So congratulations to Madison. So she'll be out on leave for a little while she takes care of her daughter. So we're really excited for her. So to start with some studies, Project SORT, that study is completed from a recruitment standpoint, but we still have such a strong team of students who are still working on the chart abstractions for us to get the substance use disorder treatment outcomes through a year after they completed the survey for us to look at correlations of treatment response with baseline biopsychosocial variables. So once those chart abstractions are done, and we're hoping that's the goal with the new cohort of students this summer, fingers crossed, that we'll be able to knock out the rest of those abstractions by the end of the summer, which actually coincides with Michelle's due date when she has her baby too in the fall. So hopefully we'll have lots of things going on this summer. Registry study is similar. We have also stopped recruitment for that study, but we have 160 people, which is amazing. And we also have a team of students who are also working hard on getting those chart reviews ongoing. Those will probably take a little longer than through the summer though, but that is okay. We will get that data collected prospectively over time also. And then we have multiple students who are working on their secondary analysis projects for the upcoming summer Ivy Lab cohort. Will be working with this study too. CBTIO has started recruitment, so that's exciting. James, I don't know, has anyone, how many people have completed baseline so far?
No, I think there's probably 4 who have completed baseline, or at least one of the 2 baselines.
Okay, yeah, yes.
And then we'll have like another 2, I think, within the next couple of weeks.
Yeah. No one has started the intervention yet with Michelle, but we're ready when they get there. So And so Michelle is ready to start the intervention, and then Nicole will be taking on to being an interventionist later on. And Amber has been our lead RA also for this study. Lemborexant 2.0 recruitment started today, actually, so that's exciting. So we got IRB approval and all the million other approvals, so that's great. So we're working on some last other study startup things, but we're able to start recruitment this week. So that's exciting. So lemborexant is going to be similar to CBTIO if people on Suboxone or Sublocade or Brixadi, and then also have insomnia-related sleep problems are eligible. And then for this study, they get randomized to placebo or lemborexant, which is an orexin antagonist, which has been shown to be safe and also quite effective for insomnia, but just hasn't been tested over in this patient population yet. So they'll take it for 2 months, and then we have a million measures that we look at over time, and we hypothesize it'll help people not just get their sleep better, but also just feel more stable in their recovery from a neurofunctional standpoint. So that is that study. And so we're hoping to get some people scheduled for screening visits coming soon. Project Castle, that is the project with the published manuscript. So that's exciting. And so now we're moving into phase 2, which is setting up for the pre-testing study, where we'll then do the intervention with a group of medical students. The goal of the intervention is to reduce stigma related to substance use disorders tailored for healthcare professionals. So we're starting with medical students. So we are in the study startup phase for the pre-testing study. So we'll hopefully be able to start recruiting for that in the fall. Educational studies. There are some lingering projects from that Madison has been working on with Catherine and Avni. And then this upcoming summer, we won't be studying the curriculum anymore. We'll be executing our fully finalized curriculum that has been tailored after the mixed method study that we did last summer. And so we'll have a whole cohort of students starting this summer that will be going through the summer curriculum that we've refined over the years in response to qualitative and quantitative data. And Austin and Nicole will be leading that this upcoming summer. So we have a lot of students coming, so we're excited. And then I think this is the last one. So the Jeffers Project, which James is working on a better name for this whenever we get there. So for right now, it's just named after the funder, which is the Jeffers Foundation. So this is our community engagement project that's focused on developing a community-based patient navigation intervention for pregnant and postpartum individuals who are accessing substance use disorder treatment in the healthcare setting. And so we recently moved into the second phase with James leading us, which is now working on developing this protocol using a community engagement approach. And then Nicole is also leading the evaluation of this project, and the Amber leads everything else that's going on in the background for this project. At least a lot of coordination involved with so many partners. We have one grant that maybe will get funded. I don't know. I'm waiting to hear back any minute, so fingers crossed. So we'll find out soon. And then James, do you want to talk about the Research to Recovery conference?
Yeah, I can mention it. So the Research to Recovery Conference is a conference that's been going on for maybe like 5 or 6 years now. So Tom Bannard from Rams in Recovery started the conference, and it's not a traditional academic conference. It's heavily attended by both the community, so the recovery community, as well as practitioners. So a lot of counselors, peer recovery specialists, in addition to academics and researchers and scientists attend the conference. So that starts tomorrow. You'll see both Nicole and myself there. Nicole is leading a big panel on the future of addiction treatment, which is very cool. And I'll be talking about like community engaged research and things like that. But it's a really great conference. If you buy a ticket now, I think it's like $130 to attend in person, but you can get like I think like a Zoom link for like $30 if you see anything that you're interested in.
Awesome. And then once Amber and I figure out the date of the next lab meeting, we'll let everyone know. But it is summertime coming up and lots of schedules, so be patient with us as we maybe try to mush together June and July. But we'll figure that out later. Amber is out this week, but as always, you email her with any questions or concerns. And then I'm gonna stop here. James, is there anything else to share I did not say?
No, I think you covered everything.
Wow, impressed with myself. Okay, great. So, Erin, I'm going to hand things over to you. Before you start with your presentation, please give everyone a background about who you are, where you're at, and the purpose of this presentation. That way everyone can be on board with giving you appropriate feedback, given the audience that you will be presenting this presentation to later on, which is different than sometimes what we do.
Sure. Thank you, Dr. Martin. Hi guys, my name is Ira Prakash. I am a senior in high school. I go to Maggie Walker and I'm actually graduating next week, so that's good to look forward to. So the purpose of this project is I'm going to be presenting this project to my high school class, and it's kind of just a recap on like my role in the Ivy Lab and just some things that we've been focusing on. So I've been part of the Ivy Lab for about 9 months now, and my role is mostly on the social media aspect. So we have 4 main platforms that we've been looking at. I'll go into it a little bit later throughout the presentation, but the 4 main ones are Instagram, LinkedIn, Twitter, and Threads. And so our social media is still relatively new and it's still very growing. So I'm going to give you guys like a recap on our numbers over the past like about a year from last August, and then we can see like some trends and just like how we're kind of using social media to like address barriers and like disparities from a public health aspect. So I'm going to go ahead and share my presentation and we can get started. Okay. Okay, so it's titled Substance Use Disorder Recovery for New Mothers Through Social Media. And then just reiterating what I said, it's kind of just how we're using social media as like a solution and way to address common trends that we see with our patients. So as you guys know, there's 3 main goals of the Ivy Lab. The first one is to intersect both addiction health and reproductive or sexual health. The second one is not only just studying how biological and psychosocial factors relate SUD treatment, but also bringing awareness and giving more of a support system so people are more comfortable to talk about these topics.
Ira, I don't want to cut you off, but we're seeing the wrong screen. So we see not your slideshow view.
Oh,
I didn't want you to keep going.
okay.
It's be the wrong screen.
Okay.
There you go.
Can you see it now?
It's thinking.
Oh, it says your sharing is paused. Resume.
It says loading still.
Oh, I see what you see. Okay. Okay, I know that you can see here, but then when I click slideshow, it says that my sharing is paused.
Yeah, that's special. I'm not sure how to fix that. I'm sorry.
No, it's okay. Here, what I can do for now is I can just present it this way if you guys are all okay with that.
Yeah, that works.
Yeah, just to like save time.
Yeah, you're good.
But yeah, so those are our 3 main goals of the lab. Next, I'm going to start talking about how this presentation is going to be formatted. So there are going to be 6 parts of this presentation. First, I'm going to kind of explain what data like the study is coming from and where it's coming from. And then I'm going to show you guys an example of one patient. And then we're going to look at the details of their case study. And then we're going to use that to help identify like common barriers that we see with our patients and then what we want to keep in mind when we're treating them. After that, I'm just going to kind of show like the role that our social media has to addressing the barriers. Like I said, our social media is still pretty new. And so that's why I'm going to show us some stats. I also have a fun little quiz for you guys to show like an example of some posts that we have. And then I'm finally going to end it with like the importance of this topic and how like the relevance and how it plays a role into society today. Okay, so first, the study that I'm going to be looking at is the Project Better study. Initially, the study was used to test a educational and technology-based program for prenatal care. So this was for new mothers, but the data I'm going to be looking at is more on the demographic side. And one thing I want to let you guys know is this is more of a descriptive analysis. So I'm not going to be making any conclusions about any demographic groups. It's just kind of like the trends we tend to see and like barriers and limitations they have when they are getting treated. And the way that the data is collected is that like one of our certified lab technicians fills out one of these forms for the patient. So it's not a self-survey, it's more of like a direct in-person visit. Okay, so I'm going to be looking at 5 specific variables. When diagnosed with substance use disorder, society often use like these patients subconsciously in a negative way, and that's why it's kind of important for us to like advance and tailor our approach to like each individual with their own idiosyncratic needs. And so here's an example of like these 5 categories that we look out for so we can kind of just best prepare ourselves for how we should approach each patient and like really strengthen the provider and patient trust. So the first one that I have is Child Protective Services and CPS involvement. So stigma is not just societal, but it's also institutional. And so recently, a lot of states have enacted policies that are like criminalizing drug use during pregnancy. And so this has really increased a strong distrust of the healthcare system among pregnant women. So a lot of women have started to avoid prenatal care or even just forgoing medical care all in general to prevent the risk of not only arrest, but losing their children. So it's important that we can give them treatments that support that their family, support their family needs too. And that way we're not just only only looking at one person, we're kind of looking at the bigger picture as well. In addition to CPS, we also kind of look at demographics, and of course, like demographics doesn't mean to stereotype people. It's just all these trends can kind of help us give a better treatment and like what to look out for. So one stat that I had found, which was interesting, was Black and Indigenous people, they tend to face more involuntary drug tests and are reported to the authorities more common, despite the fact that racial groups are equally substance abusing. So this is also another good thing to keep in mind. Another one is mental health status. So one example is, according to the National Library of Medicine, depressed patients are 3 times more likely to be non-adherent to their medication. So it's good that we can keep track of how often that we are catching up and looking at their adherence, so that way we can make sure that they feel like more supported along the way and that they're more adherent to their treatment plan. Another one is nicotine use. So nicotine and cannabis are 2 of the most commonly used drugs in the world. And so more than just looking at what interactions like this could have with other drugs that we're giving them, it's just important to know what like their daily life kind of looks like and what their past history has been. And then finally, we want to look at time on their medication for their opioid use disorder. This kind of just is a good thing to know because a lot of studies can indicate that people who have a longer time of MOUD, they tend to have reduced relapse rates and improved adherence. So then not necessarily that we're trusting these people more, but it's just good to keep in mind that they're a little bit more familiar with the process that we have to go to. So those are 5 variables. And so now I'm going to go on to our case study and a patient example. So this patient, we have like their demographics on the left. As you can see, for their race, they're American Indian or an Alaskan Native. And for their treatment plan, they have methadone, and their dosing frequency is twice a day. They have 50 milligrams in the morning and 50 milligrams in the evening. Another thing is that they have 6 other meds in addition to this one, and they have also been consistent with their methadone treatment, and I'll go a little bit into that later as well. So this person was using nicotine when they first found out they were pregnant. So this can kind of show sometimes like there could have been a disparity where they didn't know the harms about it to the fetus as much before. So this is something that we can look at with our social media, we like bringing awareness to like facts that people are less educated on. So this can be like an interesting topic to tackle later on. And then this has some of like their later nicotine use as well. So like they're no longer currently smoking cigarettes or e-cigarettes. So their nicotine consumption has decreased over the time of their treatment. And then for their CPS involvement, you can see that they do have children and they have interacted with CPS before. So they've been investigated by CPS, but their children haven't been removed. And so they're all in their custody. So this is good just to keep in mind, as I said before, just like making sure that we know that they also have other responsibilities just in themselves. And so it's important that we like take into account their whole picture. And then just some more additional information. They have been taking their medication for longer than 2 years. So this means that they're pretty consistent with their medication. None of their infants were treated with neonatal opioid withdrawal symptom, but they have had an overdose before. So going into like some barriers and trends that we tend to see, they have experienced an overdose before, and they do not have access to a device at home. So this disparity in technology is one that we see pretty common with our patients. This kind of tells us that it might be harder to reach them when they're at home, so we should really use our time wisely when we do see them in person. And that way, like, we can target like when to see them, like whether it should be more commonly in person, and then that way you can keep up with like their treatment plan more often, or maybe like find another intervention because it's not as accessible to reach them at home. So for example, like if you haven't heard from them in a while, like the reason might not be that they're not following their medication. The reason might just be that they just don't have access to something vital for us. And then for psych history, they have depression and anxiety/panic disorder. So this kind of goes in with the mental health status we have before. Like this could account for like their actions during the meeting. Maybe not just like simply out of fear, but just with their psych history in general. And the insurance of Medicaid/Medicare just kind of tells us a little bit about like their income group. And then this can help us like really show them all the paths that they can take towards a treatment medication to help them best decide. Okay, so now we're going to go into some public health barriers that we commonly see in our patients. There are 3 main barriers. The first one is transportation. So in Richmond, Virginia alone, about 7% of households don't even have access to a vehicle, and more than half of those households are led by Black individuals. So I'm going to go into that specific statistic later, but just like the inability to physically access care, like how we kind of saw with the other patient, this is like a direct obstacle to consistent engagement. And so it's harder to give them more specialized health services that can really help them because they're not able to see us in person as much. The second one is stigma. So this kind of actually ties in to the Project Castle that Dr. Martin had mentioned earlier in the presentation, especially provider stigma. But stigma is one of the leading barriers to care for postpartum individuals with substance use disorder. A lot of people feel like they'll be labeled as like a bad mother, or as we mentioned, like are scared of having their children taken away from them. Negative attitudes are from not only the public, but professional stigma is very common. And so sometimes, like if medical professionals don't have the specific training, they might subconsciously be biased. And this is like what takes away the provider and patient trust. So I know that one thing like Project Castle has been focusing on is kind of addressing that. And so like this stigma in general, this results in like delayed reporting. And then because of these feelings of shame, there are worse medical outcomes because they don't trust the provider in general. And therefore it's harder for like them to trust themselves as well. And then finally, our other barrier to care is childcare. So as I mentioned, we've gone over this a little bit before, but a lot of mothers might not be able to attend treatment because they don't have safe or affordable care. So even if they do have transportation, they just might not have the support system or even like familial or friend support around them to kind of support them while they're getting their own treatment. So like their other responsibilities are kind of interfering with their own with their own treatment as well. Okay, and now I'm going to go into our impact through social media. So the way that we've been using our social media, there have been multiple ways. One thing I have really enjoyed focusing on and try to focus on most is addressing misinformation. So each of our 4 platforms kind of targets a different audience. So one example is Instagram tends to be a slightly more casual platform. So like on this website or on this platform, like I try to do more of like these quiz type posts and more informative posts versus like LinkedIn, we try to share more about the studies we've been going since it's more of a professional platform. So I'm going to show you guys some examples of our social media. These are some posts that we've had before. As you can see, the first one, this one is a myth versus fact post. So this is like one of the first ones we made. And the myth was that a lot of women think that it's okay that when you're pregnant, you should eat for 2. And that's actually a myth. So it's actually dangerous to eat twice. And so because there's not as much education on this specific thing, these myths can carry on and lead towards more conflict throughout their pregnancy later on. So that's why I feel like it's very important. Then the one in the middle, the post that we have in the middle, that is kind of just about genetics in general and how genetics can affect your likelihood of getting substance use disorder when your family has it already. And circling back to the stat that I mentioned earlier about Black households, we posted a Black Maternal Health Day awareness post. So again, not stereotyping, but for example, one stat that we had found was Black women are more likely to have high blood pressure or cardiovascular disease during pregnancy. So as a provider, it's kind of important to keep in mind and track these things because although they may be generalized for like this certain population, it's still important to keep a lookout. That way you can address it far in advance enough to catch it early on. So here's some other ones that we tend to post. We had a cervical cancer awareness post. So I personally feel like, especially like being in high school and all, like I haven't had as much education about especially like reproductive health, sexual health, because a lot of people are like afraid to talk about it and feel more shame talking about it. But I do think that it's important to keep in mind all of these things because without knowledge, like it's harder to make the correct decisions. And so that's why like it's important that we also have like this World Contraception Day post and then like in the caption like we have some facts and ways to like take care of yourself, especially since there could be a lot of people whose households might not lack like a mother figure in the house. So especially like I think like daughters would need some sort of guidance in a way as well if we're focusing on women's health in general. Okay. And now we're going to do like one series that I've loved starting on the social media. So this is our fact versus fiction. And so every time we post, we have a different topic. And so this topic was opioid use disorder effects through generations. So these are like 4 sentences and you can decide whether they're a fact or fiction. And you guys can either just like think to yourself whether you think it's a fact or fiction, or you can put in the chat whatever you got, whatever works for you. But I'm going to read through them. The first one is, if addiction runs in your family, you're guaranteed to develop opioid use disorder. The second one is, kids who grow up around opioids are more likely to struggle with opioid use disorder. The third one is, you can break the cycle of addiction even if it's been in your family for generations. And the fourth one is, talking to your kids about opioids will make them curious and more likely to try them. So I'm going to give you guys like 30 seconds to like put your answers in the chat or just think about it. But I feel like this is like a more engaging way for like our followers to more enact with our posts. Okay. Perfect. All right. Okay, so now we're going to look at the answers. If it Okay, so now you can check if you're right. So the first one is false. Although you might be more vulnerable, you're not particularly destined to get it. Genetics are a part, but also educating yourself in time, having a good support system, and being in the proper environment can also help you. The second one is if you are exposed during childhood, whether it's parental use or even prescriptions, this can increase your risk, but again, like early education can help you change that. So that's why, like, presenting these facts through social media, especially I feel like a lot of teenagers and high schoolers are most prominent on Instagram, although it's still growing to everyone. It like this platform is more easier for like younger generations to see and keep in mind with as they go on. The third one is a fact. So recovery is possible. And a lot of people kind of show that like the generational change is real and that healing is real. And the last one is false. Honest conversations with your kids can reduce risk. And if studies have shown that when kids feel more safe asking questions, they're more likely to make the right choices and not risky ones. So again, like silence is like the silence and the fear of not being able to talk about it leads to the wrong decisions because there's like always a lot of fake news going on around the internet. And like I know especially like if you try to search up like a health fact on Google, there's always like there could be 10 sites saying one thing, but then like there could be one site saying the actual fact, so it's hard to know. Okay, and now we're going to look into some of our analytical reports. So these are our follower trends. We're looking at this from August of last year, so August of 2024. As you can see, Twitter kind of has the most followers, and then it's followed by Instagram now, LinkedIn, and Threads. So this is just this is our Instagram. We have about 27 posts, and I'm not going to go through all of these statistics, but you guys can just take a second to look at them. What I like most about this is how many impressions that we've made. So impressions is just kind of when we show up on someone's feed. So it's good to know that even if like the likes aren't as high as like we would imagine, it's still showing up on more people's feed. And that's kind of, even if people are just like getting a good glance at it, then it's good to know that they're engaged. Okay, so here are some trends. Our profile and impressions have gone up a lot. One thing I really like about this is ever since we started our fact versus fiction posts in March, we can kind of see the number of impressions and profile reach going up. So this graph is also good to know, good to show us what type of posts are getting more impressions. That way we can make more posts alike as what we've seen in the past. Okay, and then this is our LinkedIn. We have 1,023 posts and our follower numbers are still growing. On LinkedIn, just keep in mind that this is where we mostly show the studies that we're working on. So even if people aren't interacting with the posts as much, it's more likely that they could be clicking on the study and then reading the studies themselves. Okay, and then this is just some of our LinkedIn page in general. So what we can do is we can like go back to like October of 2024 and see like what post this was. And then maybe we can see like focus on that type of topic or that format of post in the future. And then this is Threads. I know that this looks a little bland, but what I think is important about this is Threads is still a growing app, so we're not too discouraged about these results. This is mainly just to be put in here so we have like a baseline if someone were to analyze social media again and to see how it would grow. So hopefully like I hope that in a year from now, if Threads is still like a growing app, then we would have more posts and followers. Yeah, so we lost a follower, but that's okay. Yeah, like we'll just keep in mind for this for the future. Okay, and then we have Twitter. So we have 36 followers from Twitter and 26 tweets and 11 impressions. So you can see here in March 31st of last year, that was when we had the most impressions, but we haven't been as active on Twitter as the other apps. So this is also something good to keep in mind. Okay, And now finally, just the relevance and further steps of it all. All of this is kind of just to tailor our recovery towards not only groups, but certain individuals themselves, not only during pregnancy, but also postpartum as well. It's also just to educate how addiction is interacting with sexual health and spreading awareness about gender differences, contraceptive health, reproductive health, um, all of the big branch of like what the Ivy Lab kind of focuses on, women's recovery in general. And for further steps, like what I would hope to see is that like in the next year, like we keep on getting more followers. Hopefully we even can like start working on new platforms that might emerge later on. I know TikTok is a very big platform, so if we did have time to maybe intertwine something like that, I feel like that could be a really good take on it. But that's all that I have for you guys. Thank you guys all for listening to my presentation. Do any of you guys have any questions that you'd like for me to address?
Great, Ira. Good job. Congrats.
I do have a question, if that's all right.
Mhm.
I was curious if you kind of knew, so you mentioned like the differences in like our follower population on
Mhm.
like LinkedIn is typically, or like, it's a more professional. I was wondering if you had a sense of like who was following the lab. So if it's like academics, students, community members, if you had any idea on those. I don't know if you all have looked into that.
We haven't looked into it too much, but the way that we kind of start off all of our platforms is that we try to follow more academic accounts, and then we try to follow our own lab members as well. So that way we keep it more of like a professional account, but it's still like public, so everyone can still access it. Although I do think it would be interesting to like analyze like who has followed and left, but we usually just start out like following other VCU labs in general.
Yeah, I know it's challenging. I've
Mm.
been an undergrad social media person for labs before, and it's hard, especially the public health social media. They just like, even if you look at like the Virginia Department of Health,
Right.
like very few followers. They get like 15 likes at a time. But yeah,
Yeah.
I'm curious to see how it'll grow. And then yeah, I know the TikTok stuff is challenging because when I was trying to do that, TikTok was banned on VCU campus, so they wouldn't let us.
Oh, okay.
I
Yeah.
don't know if that's still true though.
Yeah. That would be something good to look into for the future. I know that TikTok might be more of a time-consuming app, but I think it would still be interesting because I feel like a lot of my friends have it and I use it every day, so more than like LinkedIn and everything else. So I feel like if like we're targeting more younger generations, it would definitely be a good idea to use in the future. Yeah. Any other questions?
Hi, Ira. Great job with your presentation. I think I was just wondering, like, given your experience helping the Ivy Lab with their social media, what are some topics in the maternal health or substance use field that you think would be beneficial for our patient population, like for us to cover in the future?
Okay. So like what topics we want to specifically focus on with our patients?
Yeah, like anything that maybe you think would be like helpful in the future for us to like discuss, like given kind of some of the topics we've covered before.
Mhm. Well, I mentioned reproductive health and contraceptive health. So we did have a World Contraceptive Day post, but we didn't have like where to get resources. So I know that one thing that we've been talking about um, from like a reproductive health standpoint is like resources in the greater Richmond area in general. So I think it would be good to like include like free resources and like free clinics, as well as like more open clinics like 24/7. And then another thing from an opioid use disorder is that we were talking about like giving a post about needle programs. So like if you find like needles on the road, there are sometimes like boxes in Richmond. And so I didn't know about it until I talked about it with Arjun and Amber. but I thought that was very interesting to keep in mind because sometimes like people find things that they don't really know what to do with them, so they just kind of leave them, but then that needle could have traveled somewhere else in the population and like led to more like the spread of disease or something like that. So I think that would definitely be very helpful to post about in the future.
I really thought you did a great job of, well, making simple, pretty complex ideas and talking about things that are sensitive, like disparities in a way that was very understandable while also capturing the complexities, which is a hard thing to do. So I thought you did a really nice job with that. And then I have like 2 comments about social media, which is really hard because I feel like I go to social media to see like absurd, stupid memes and like inappropriate, like it's an escape, right? So it's a hard, in some ways, that like we have to be sincere because we're trying to inform people, and that authenticity and sincerity is kind of counter to how a lot of people utilize the internet. But I was wondering, so it's hard, you're doing a very hard thing, but I go to Reddit for a lot of information, which is like probably really a bad idea and also maybe age related. But I was wondering like what it would be like to show up on Reddit kind of as a resource, even in some ways, like ask me anything, even though you have to, something like that. Yeah.
I think that'd be a great idea. Maybe we could definitely look into starting something like Reddit in the future. I also like whenever I have very specific questions, I'll type it up and then Reddit comes up. So maybe like having an account like that would be very helpful. I didn't even start using Reddit until like recently, for getting like any information because my questions would be like very specific. So I think it would be good to start now that I know more about it, but it wasn't something that we had originally thought about. But I do agree that like maybe like more lighthearted platforms would be good. So that's why I feel like Reddit and TikTok, but there's like a certain amount of professionalism that should still be kept. That way like people understand that like people don't assume that is fake news either. So yeah.
I do have another comment and question. I forgot about this, but I did like how you like explained through the participant experience. I think that was actually much more helpful for me to understand instead of, how we see like, a study protocol or something. So I thought that was a good way to display that. And then the other thing about social media I was going to mention was one thing that was really helpful is I did a series on I'd like seen some research by a couple academics in Richmond. And so I wanted to see like the crossover with the research. So we were doing like cancer disparities. And so I did like a whole series on redlining and like heat related illness and stuff like that that have been researched in Richmond, and then kind of applied it to our patient population. And what was cool about that is I was then able to get reposted by the like relevant like organizations that had originally done the research. So like I think it was Richmond and Henrico health districts and stuff like that. They like reposted our social media and we got like 40 or 50 likes, which was pretty cool at the time.
Yeah, I think in addition to like the fact versus fiction posts, we usually also on Instagram, just not as often with the fact versus fiction posts recently, but we did post like some studies that we had done. And so we would take like the abstract and then kind of like give like 3 conclusions. So I think it's also important to still keep up with that. And then like we can like tag like relevant organizations, and then hopefully that kind of carries on with the like truthiness of it too. Any other questions, or like even like any way to improve this presentation would be helpful. Like, yeah.
Wait, Ira, I just wanted to ask a quick question. Like,
Mhm.
I remember you telling Amber and I that your school presentation was like cut from 45 minutes to like another amount. Is it like 20 minutes that you have?
It's like around 30. So
You should be fine
yeah,
then. I
it's
was like
like
timing it to make sure.
yeah, so me and another friend kind of have an hour and 20 minutes, but we kind of save time for questions. But if like one of us goes over or under a little bit, then it's okay to take away the questions. So we kind of split the 1 hour and 20-minute block in half. But yeah,
Yeah, great job.
thank you.
I was timing you, and you were about 24 minutes, so
Okay.
you're doing great. So you can even, I think I thought you talked at a very good pace. you know, so I think you can do exactly that and it'll be good for your time.
Okay, perfect. All right. Any
Well,
other comments? Thank you.
That was a really good job. We're so excited for you. Is this like one of your biggest last things before you graduate?
Yeah, my school ended. We just have exams this week, and then every senior kind of has like their own presentation, and so we kind of split up the school into different classrooms. So like we're paired with someone else. And we kind of have like an hour and 20-minute block to kind of just we all have a different mentorship project or a different like lab that we've been working at, but some people also have like law-based projects, so it's not all medicine, it just kind of depends. Like one of my friends is like agriculture or like how they're using like parking spaces to like I don't even know like how they're optimizing parking space plots. So like it's a big variety, so it's one of our last things to do.
Well, congratulations ahead of time.
Thank you.
You did a great job. We're excited for you.
Thank you so much for having me, but thank you guys for your time as well.
Well, thanks everyone, and we'll see everyone later, okay?